Good evening, Ravi, sir. Welcome you, sir, for the webinar. Sir, please check your audio and video. Good evening, sir. Sir, can you hear me? Good evening, Vijay, sir. Welcome to
Good
the
evening.
webinar.
Good
Please check your
evening.
audio and video.
Yeah. Yeah. Can you hear me?
Yes, sir. Yes, sir.
I think video is also okay.
Yeah, thank you so much, sir.
Thank
We'll
you.
start at 4.
Yeah. Yeah. No issue.
Welcome, Dr. Aprajita. Kindly check your audio and video, ma'am.
Good afternoon. Am I audible?
Yes, ma'am.
Thank you.
Thank you, ma'am.
Hi, can you guys hear me?
Yes, sir.
Yeah.
Welcome you, sir, for the webinar. Thank you.
Thank you.
For joining.
Alisa. Hi, Sharon.
So,
Hello, sir. Welcome.
Welcome. Good to see you guys. So sorry, it's a biking day. It's a weekend for me. So
yes, no
yeah,
issue, sir. So we are
yeah,
going to start the webinar. So
sure.
good evening, everyone. A warm welcome to the 12th webinar of the webinar series on adolescent and youth. I'm Sharon Augustine, moderating the webinar with my colleague Aliza Hassan. And like every webinar, here is the free survey form on your screen. I request everyone, as well as the panelists, to fill in. Thank you so much.
Good evening, everyone. My name is Aliza Hassan.
I'm Sharon Augustine, and we together will be moderating the session.
So let me all introduce you with SHARP. SHARP stands for School Health Annual Report Program. It is a non-governmental pan-India health organization, and we have recently completed 21 years in this field. We work for the healthcare of students and children, which is professionally managed by eminent psychologists, nutritionists, counselors, and people like you and I who have vision to promote healthcare. In relation to hand washing, SHARP supported hand washing and hygiene practices in Nabha, Lucknow, and Hyderabad, impacting more than 14,000 lives, including Anganwadi centers, women in school, and children.
We think hand washing is the smallest task we perform in our daily life, but we don't realize it is the most powerful weapon to prevent us from all the deadly disease. In this pandemic, hand hygiene and building our immunity become the need of the hour to prevent ourselves from COVID-19 with other preventive measures such as wearing masks, maintaining physical distancing. We, as a public health organization, through our public health activities, are trying to reach every corner of the country. And this webinar series comes out of one of such initiatives.
COVID-19 pandemic has left a big room to discuss on wash practices and hygiene. Importance of wash practices. We are celebrating Global Hand Washing Day and World Food Day this week in the webinar. For the same objective of a discussion, we have with us our esteemed panelists, Dr. Vijaypal Singh, Dr. Arpita Suman, Mr. Ravi Bhatnagar, and Dr. Manisha Sharma. We welcome you all.
A few instructions before starting the webinar. Each panelist will speak first for 5 minutes, and then we will be taking up the question for Q&A round. Please drop the question in the Q&A box with the name of the panelist. And I request all the panelists to stick to the time limit. We request the audience not to flood the chat box with unnecessary messages because we tend to miss out the important questions. Over to you, Aliza.
Okay, so I would like to welcome our first panelist, Mr. Vijaypal Singh. At present, he is working as a Joint Director in Food Safety and Standard Authority of India, having a rich experience of 26 years in research and teaching in varied field of science. He is also a board member and expert in 10 international and national accreditations board, organized 44 national and 7 international training program, led world's biggest cyclothon to nudge people to eat right through Swasth Bharat Yatra in FSSI. Over to you, sir. Sir, are you here?
Yeah, I am here. Can you hear me?
Yes, sir. Over to you.
Okay. Just a minute, start my video. So, good evening, everyone. I have been given 5 minutes, so let me start my watch. Okay, so this is basically I want to appraise you all about the Eat Right India initiative, and in that initiative also we are having an initiative called as Eat Right School. So why the food safety is important? Coming to the first question, children under 5 age, or they are 40% more riskier surely around the health, and they are nearly 30,000 deaths every year because of the child disease, and they impose a lot of disability, that health related disability. Nearly 8 million people are suffer because of the not doing proper hand hygiene. And at FSSAI, we are doing maintaining standards. We are also testing the food, and we make sure the food that reaches you is also safe. And also we are doing a lot of training and compliance. We make sure from the farm to the fork that food that reaches you is safe. And we are, as a regulator, now we have started to make that eat safe, eat healthy, and eat sustainable. These are the 3 pillars of Eat Right India movement: eat safe, eat healthy, and eat sustainable. What is there in eat safe? As Aliza was telling you, that it is very important to maintain the personal as well as surrounding hygienes. Okay, something is popping up. Okay, and second thing is we have to combat the adulteration, and for that adulteration combating, for the school we have a magic box that we provide to school so that they can do simple tests, 100 tests at your school level without much and big and machineries. We also eliminate for toxic residues which are there in the food, and we also maintain the food in such a way, and we teach the students in such a way that they can also avoid the hazard by using the cooking oil, not time and again. We should not use cooking oil again and again. It can be used only once, twice. If the total polar compound goes beyond 25%, that we should not use that oil again. Eat healthy. We should have a balanced diet, eat healthy, eat less, eat timely, and use to diversify the diet rather than eating same thing again and again. Diversify. Eliminate trans fat. Trans fat are those fat which are very deadly and not good for health, but in taste they are very good. So if you find a bakery, confectionery, packed food item, they are full of trans fat, and you may find them very tasty, but they are not good for health. You should also reduce the sugar, salt, and saturated fat in your food, and also eat fortified. The food which is having plus sign, which is added with a lot of vitamins, additional mineral. Eat local and seasonal. It is local and seasonal mean what is available in your local, what is available in this season, rather than eating something which is very expensive and out of season, because that nutrition is required and needed for that season and that seasonal disease. Don't boost fade. If you are having a canteen or a mess or something, and if you are having some spare food, try to contact those agencies which are taking food from you and also sending to the really need one. And also recycle the plastic which is there, use should be recycled and conserve water and reduce chemical in the food chain. We have issued a guideline during COVID, like Eat Right COVID, which is available in our website at, if you just Google Eat Right during COVID into FSSA website, this is available free of cost. We are teaching children early about how to handle and prepare food to help create a new generation of healthy consumers, so that you can, because the children are very good in adapting the early childhood practice. So we are very keen that we should send these practices to the school children. Eat Right School initiative, just I want to tell, it is the initiative which is launched by FSSAI under the aegis of Ministry of Health and Family Welfare. It is aligned with the school health program under the Ayushman Bharat, a healthcare program of Government of India. Eat Right School aims at creating awareness about the food safety, nutrition and hygiene among school children, and through them among the community at large. A rich repository of content is created like Yellow Book and other resources which is available in Eat Right India and Eat Right School website. Expert for school curriculum and for student and teacher is also, there are a guideline which is available. There are health and wellness ambassadors. We are also creating health and wellness ambassadors who are college going school and SNF fellows who can go and teach and contact the school and make school to enable them to how do they become Eat Right School. So there are steps involved in how do you make your school as Eat Right School. First, you have to register at the website www.fssai.gov.in/Eat Right School. Then create and certified health and wellness ambassador. So ambassador HWA we call them, will come to you and they will do your online certification program on the portal. They conduct awareness and Eat Right activities in your school, and they upload the activity on the portal, and we monitor and evaluate through the Eat Right metrics, and then Eat Right School certificate is given to the school, those who participate. So this website is open and is available and live. Just Google and you will find it. Okay, and following, something is popping up in between. Okay, so we have a Eat Right School metrics. So in that Eat Right School metrics, we have section A, section B, and section C. Section A is for all, and there are different activity available in that one, like whether you have adapted the school yellow book or not, activity book or nutrition kit and food safety guidance. So there are multiple things, because you have given me 5 minutes, it's not possible to explain to you, but there are section A, section B, and section C, where you have different activity and there is a mark assigned for that. And if you do that activity, then this mark you will get, and by marking you will be assigned over the status of Eat Right School or not. I want to just tell one more thing which is really critical, important last, because I have finished the time. We have two important things that we have come up with a new rule that is called as Food Safety Standard Safety and Healthy Diets for School Children Regulation 2019. Under this, we make sure that unhealthy food, health food which is high in salt, fat, and the sugar should not be sold in the 50-meter diameter as well as in the canteen of the school. And this is the responsibility of the school authority to ensure the food is safe and healthy on the school premises, promotion of safe and healthy food in and around the school premises, and there should be monitoring and surveillance, and food marketing and advertisement to the children should be taken care. And before I go to the last piece, there is we have just now, as Aliza was mentioning, we have launched in the yesterday a food safety day, Eat Right Creativity Challenge for the school. So there are two contests in that. One is a photography contest, another is a poster contest. So for the 3 to 6, 6 to 9, 9 to 12. So till 9th of the class, there is a poster competition. From 9 to 12, there is a competition where you can just click the photograph in relation to the food safety, upload on the website, and the website name is Eat Right Creativity Challenge. So www.fssi.gov.in/creativity challenge. So with these words, I would just like to say thank you for the opportunity, and I will be open for any question. I'm so sorry because of the time constraint, I have to rush. Thank you very much.
Thank you so much, sir, for sharing the initiative of Ride Safe and Eat Healthy, and also about food diversity and sticking to the local and seasonal food. Thank you so much, sir. The next panelist for the day is Dr. Abradita. She is currently working as knowledge management and communication specialist in Swachh Bharat Mission at the Ministry of Jal Shakti. She has 20 years of experience in various government programs, international NGOs, UN agency, extensively worked in the field of WASH, livelihood, health, nutrition, gender, and disaster management projects and programs. We are glad to have you, ma'am. Over to you, ma'am.
Thank you. Thank you to Sharp NGO and my fellow panelists, dear children. A very good afternoon to all of you. I'm sure since I myself am a mother of 11-year-old, so I know for children, unless the topic is very, very interesting, Saturday evening getting glued to their mobiles or laptops and listening to some gyan on wash, it must not be easy. So I'll not get into the details because I see children today's age are much way beyond our understanding of issues, and I'm sure you would have got also as a result of the quiz that you conducted. And those were like pointed questions, and again I'm sure most of the children would have got it right. So without really getting into the nitty-gritties of wash and kitni baar haath dhona hai aur कितने सेकंड तक धोना है वो आज के बच्चों को बताने की जरूरत नहीं है.
Right, ma'am.
So what I'll want to talk to you children is that typically क्या होता है, since most of you come from urban setups, that as children we think that okay, here is something which the world is talking about, hand washing karna hai, so that is one thing that I can do and sort of responsibility to do with. What else can I do? और ऐसा लगता है कि ये तो बड़ों की बातें हैं, we as children हम क्या करेंगे and stuff like that. So I like to bring to you some of the stories from rural India. Since I am currently working for Swachh Bharat Mission Rural Gramin, so I'll want to narrate to you some small stories about rural India as to what is it that children can do and how much can they really influence not only what they are doing, but their friends, teachers, their parents. So those are the stories I'll want to tell. I don't know how many of you would have ever heard the term called Swachhagrahi. I'm not sure, since this is not an interactive medium, I'm sure I'll not get really answer. So typically what happens, आप बच्चों में जिनका interest होगा in history, you would have heard about Satyagrah. Satyagrah and movement which was led by Mahatma Gandhi himself, since we are talking in the month of October. So in that movement, Mahatma Gandhi said that Satya ke liye agrah karna hai. We have to ask about all things which are true. We have to mobilize people towards truth and movement. So those people were called Satyagrahi, जो सत्य के लिए आग्रह करते थे. Similarly, our Prime Minister said that now let us do agrah for swachhata, cleanliness. Now, all this story is much before current corona pandemic. And then he said कि अब जो भी स्वच्छता के लिए आग्रह करेगा हम उनको कहेंगे स्वच्छाग्रही. And after this clarion call by the Prime Minister, do you know who emerged as the biggest Swachhagrahi in the country and especially in rural India? Children. हमारे सबसे बड़े स्वच्छाग्रही बन के जो आए वो बच्चे थे, छोटे छोटे बच्चे, स्कूल के बच्चे, कॉलेज में पढ़ते हुए बच्चे, एनएसएस के कैडेट्स। और उन्होंने न केवल अपने लिए किया स्वच्छता का काम, अपने गांव के लिए किया, अपने स्कूल के लिए किया। एंड सिंस आई आल्सो हैव लर्नड टीचर्स एज एंड some of the principals as our audiences today, I like to urge to them and also to extend my thank you to them as from our Swachh Bharat mission, क्योंकि उनका जो काम था that traveled much beyond द इमीडिएट मैंडेट। जब कोई बच्चा घर में आके कोई बात कहता है तो केवल उनके पेरेंट्स नहीं सुनते, आसपास के परिवार वाले सुनते हैं, मोहल्ले वाले सुनते हैं। और जब टीचर्स कोई बात कहते हैं तो वो एक बच्चे से नहीं बात कर रहे होते, वो एक पूरी सोसाइटी को एड्रेस कर रहे होते हैं, वो एक पूरी सोसाइटी को इन्फ्लुएंस कर रहे होते हैं। नाउ ऑल दिस वाज हैपनिंग ओनली पर्टेनिंग टू at one point of time mere cleanliness, swachhata, and within that we were talking about people constructing toilet, using toilet. I know for urban children it is not a big deal, but in rural India it used to be a problem, जहाँ पे लोग ओपन डेफिकेशन के लिए जाते थे।
Right.
तो उस समय उन छोटे छोटे बच्चों ने बिल्कुल जिद की। इफ आई वर टू टेल यू वन इंस्टेंस फ्रॉम अ रूरल village in Champaran district of Bihar, where we went for one of our mobilization initiatives, there were small children who joined our team, and then they came up with a campaign called as Mujhe Shauchalay Chahiye। छोटे छोटे बच्चे वो सुबह शाम गांव में जुलूस निकालते थे, वो अपने स्कूल में प्रोग्राम करते थे और कहते थे मुझे शौचालय चाहिए। सो व्हेन अ चाइल्ड इज आस्किंग for something, of course the whole society listens and then the society agrees. So now what one is talking about is from swachhata to sampurna swachhata, which is complete cleanliness. And we understand this is an issue which is in both urban and rural India. So in both urban and rural India, the biggest issue today is waste management. Waste management in terms of solid waste management. I can see message wherein with Hindi there is a problem.
Yes, ma'am. If you can,
Yeah,
please.
so I'll continue in English, no problem. So there what is happening is today waste management is emerging as a huge problem. Be it solid waste management in which plastic is again, and I think recently there was some campaign and children have participated a great deal in that. So waste management is the next aspect that we are speaking about in the immediate context, wherein we are talking to children. Of course it is about hand washing at all critical times. When we say critical times, what are those times? After using toilet, before having food, after having food. In view of current corona times, we have to often wash our hands and use the right regimen which is to be done. But within the limited time, I'll take this opportunity to urge to all of you children that let us be aware of right wash practices, right health practices, and not only ourselves. We should also ask others to follow those practices, because by doing that, what we are doing, we are not interfering with others. We are actually acting as behavior change agent. Children can be biggest behavior change agent. Today when children are there in the society and they pick the wrapper which is strewn around, I mean that message goes much beyond than any hoarding, any advertisement, any celebrity message. So that is where I like to end. We also had I guess one small video. I am not sure if that can be uploaded. A video I had shared with Sharp team. Can we have that video?
Yeah, sure, ma'am. Just a second.
Yeah, sure. So basically that video is pertaining to Global Hand Washing Day. And on that day, the Minister of Jal Shakti, he had a message for all countrymen. We also had one letter from Honorable Prime Minister to all countrymen and of course directed at children, wherein he has urged everybody to practice all the correct wash methods, including hand washing, of course.
प्रिय मित्रों, नमस्कार। हम सब जानते हैं कि कोरोना की आपदा तेजी के साथ में फैल रही है और इससे बचाव के लिए वैक्सीन का आविष्कार एवं उपचार हेतु दवाओं की खोज का प्रयास अभी जारी है। लेकिन जब तक ऐसा नहीं होता, बचाव एवं सावधानी ही इसका एकमात्र उपचार है। सभी को हर संभव सावधानी बरतनी है और तनिक भी ढिलाई नहीं करनी है। व्यक्तिगत स्वच्छता के सिद्धांत में हाथों की स्वच्छता अत्यंत महत्वपूर्ण है, जिसमें शौच के बाद, खाना खाने से पहले, खाना बनाने से पहले, शिशुओं के मल की सफाई करने के बाद साबुन से हाथ धोना नितांत ही आवश्यक है। अच्छा स्वास्थ्य बनाए रखने के साथ साथ इसे कोरोना की महामारी से बचाव के लिए भी अनिवार्य शर्त माना गया है। साथियों, कोरोना वायरस से बचने के लिए आवश्यक है कि सभी बार बार साबुन से हाथ धोते रहें, ठीक से मुंह व नाक को ढक कर रखें, एक दूसरे से 2 गज की दूरी बनाए रखने का ख्याल रखें। हमें यह बात अपने दिल और दिमाग में बिठानी ही होगी कि जब तक दवाई नहीं, तब तक ढिलाई भी नहीं। वैश्विक महामारी कोरोना से बचने हेतु, जैसा मैंने कहा, सबसे जरूरी है साबुन से बार बार हाथों की अच्छी तरह से सफाई करना, हाथों को धोना। इसे हमें अपने जरूरी आदतों में शुमार करना होगा। यह हमारे लिए व्यक्तिगत स्वच्छता का महत्वपूर्ण हिस्सा है। वर्तमान में स्वच्छ भारत मिशन ग्रामीण का द्वितीय चरण आरंभ हो चुका है, जो ग्रामीण क्षेत्रों में ODF प्लस अथवा संपूर्ण स्वच्छता के लिए समर्पित है। इस चरण में मुख्यतया ODF की स्थिति को बनाए रखना, शौचालय को नियमित उपयोग और व्यक्तिगत स्वच्छता संबंधित व्यवहार परिवर्तन के प्रयासों पर जोर देना शामिल है। हाथ की स्वच्छता को सुलभ और स्वाभाविक चलन में लाने के लिए 15 अक्टूबर को पूरे विश्व भर में ग्लोबल हैंड वॉशिंग डे ऐसा मनाया जाता है, जिसका मूल उद्देश्य साबुन से हाथ धोने की आदत को और अपने हाथों की स्वच्छता बनाए रखने को दिनचर्या का अभिन्न अंग बनाने के लिए लोगों को जागरूक करना है। आज के संदर्भ में यह सत्य है कि दुनिया की 40% जनसंख्या के पास हाथ धोने के साधन उपलब्ध नहीं है। हम हैंड वॉशिंग डे को सफल बनाने और कोरोना महामारी से बचाव के लिए प्रण लेते हैं कि हाथ धोने की आदत को हमेशा सही तरीके से अपनाएंगे और इसे अपने जीवन का हिस्सा बनाएंगे। साथ ही साथ अपने मुंह और नाक को ढककर रखेंगे और 2 गज की दूरी भी बनाए रखेंगे। याद रखिए, जब तक दवाई नहीं, तब तक ढिलाई नहीं। धन्यवाद।
Thank you. I saw messages from children who could not follow Hindi. So for those children, my apologies, but I promise the moment we have the same video with subtitles, I'll share with Sharp NGO, and I'm sure they'll be able to send it to all of you. And it will also be hosted as part of the thing. So my apologies for that. But to begin with, since we were trying to reach to everybody in the country and especially to rural children, so that's why it was in Hindi. We'll get back to you with the English ones. Thank you. Thank you to everybody.
Thank you so much, ma'am, for such a wonderful insight. I would now like to welcome our next panelist, Mr. Ravi Bhatnagar. He's a global health and public affair professional who currently heads the external affair and partnership for Reckitt Benckiser India. In few words, he can be defined as a person who has ability to attract and motivate great people to success of the company. Over to you, sir.
Thank you so much. So I have 5 minutes as there I have just in the agenda. So I will stick to the time and respect the time of others who have joined us today. So first of all, thanks to Sharp and to give me an opportunity to be there with everyone on this particular panel discussion. There are some very important days which are lined up, and some of the days which have already gone. Just to remind everyone, 5th September was the Teachers' Day, and today is the first day of Navratras. And 15th was a day of which was the Global Hand Washing Day. And the role of hygiene is there from 365 days in a year. That's what I would like to say to everyone. And it's not me, it's not you, Aliza, it's not Manisha ji, it's not Sharon. It's the kids who matter a lot. And they are the champions. We can give big bhashans and all that. But actually, the behavioral nudges start from the children. And children being the change agents, children being the torch bearers, and children being the future of the country. So I work for a company called Reckitt Benckiser, which is the makers of Dettol and Harpic both. So both are power brands, and few things which we have been doing post COVID scenario. We made a TikTok campaign on Haath Dhona for 20 seconds, and that's the world's biggest campaign on the hand washing, which has garnered over 50 billion views of the campaign till now. We are also the ones who have been working very closely with around 13 million children across India, 650,000 plus schools in India on hygiene. And hand washing being one of the part of the hygiene, where we actually focus on hygiene at home, hygiene in neighborhood, personal hygiene during illness, and a lot of work what we have been doing. The great credit goes to the children themselves and not to us as a company. We had Children Parliament on hygiene in 2018, 2019, where 2 million children actually participated. There's a great idea which came from the children themselves to start the soap bank. I was very surprised to see children deciding always excess is a problem. So there are some children who are last quintile or who are from the poorer backgrounds financially, economically not very sound. So these children started, after the curriculum and other things which we launched, children started themselves the soap banks in the schools. So now there are around 20,000 schools in India which already have the soap banks. So the birthdays are celebrated, and the child whose birthday is there, the child actually donates the soaps there. And those who don't actually, who can't afford, the soaps are given to those. What a beautiful way of actually helping each other. There are two small things I would like to end with. One is health is everyone's right, and it should not be privilege. So in the same way, hygiene is also everyone's right. It is not a privilege. And and children are those who are actually the torch bearers. And if we are able to create the right nudges for them, there are very likelihood of reducing the gap between the knowledge, attitude, behavior, and practice. I believe a lot of people who are there on this particular panel discussion are learned enough to know this. So Gyan is not required. Just a small commitment is required. That is mere 10 gaj. In English, my 10 yards. Can we take care of hygiene in our just 10 yards? Can we do that? If we are able to do that, that's the biggest contribution what we can give to everyone during this time of pandemic. And this pandemic may not be the last pandemic. In my personal capacity and in my previous professional capacities, I have responded to Ebola in Africa. I have responded to H1N1. I have responded to MERS in Africa, in Middle East. And now this is the 4th pandemic in my career, which is spanning in the last 16 years. So there are more to come. So we should not be complacent. And we should actually go by a rule book, which is defined by WHO, as well as our Honorable Prime Minister also speaks about that, as well as the public health experts also speak. One is hand washing continuously. Along with that, we should be very sure we need to save the water also, not just the water. So next one is, wearing the mask on all the occasions. Last but not the least, maintaining a social distance. And again, I would like to say thank you to everyone who has joined us on the weekend. And you can see me, I am still in my motorbiking dress. I have not changed that. And there are other people also, maybe, they have the other schedules, will not take much of the time. And I can't see Meenakshi here from Sharp. Thank you, Meenakshi, for inviting me to this program. This is my first program with you guys. And again, wish you all the best of luck. Thank you.
Thank you so much, sir. Thank you for sharing your insights and all the initiative which you have done. And as rightly said, sir, children are the torchbearers of the community, and they are the advocates, the real advocates for any program. Thank you so much. So our last panelist for the day is Dr. Manisha. She is the principal of Venkateshwar International School, Dwarka. She has approximately 32 years of experience with prestigious schools of India as teacher, head of the department, principal, and vice principal. Recently, she represented India as school educator at World's Teachers' Day celebration conference organized by UNESCO. Thank you, ma'am, for joining us. Over to you, ma'am.
Thank you. Thank you. To all my esteemed panelists also, and all the children and everybody sitting here, all educators here. It's a very important topic, and I'm very grateful to Sharp NGO that they have given this opportunity. So many webinars, I'm there taking part in so many sessions, but this washing hands, personal hygiene, health hygiene is a really, really very important issue. And we must share with each other good practices. As Jaypalji and Sri Ravi Bhattar, Prajita ji shared their views. They really so many ideas, or Swachhagraha, Jan Andolan, which is very, or Swachhagraha is very, very important. And I do believe, as Mr. Ravi Bhatnagar said, that children can do wonders. I mean, today's children and tomorrow's citizens, we all know very well. If we empower them, they can really do wonders. To today's topic regarding hygiene is very, very important. And let us share with you that if we see our, from historical perspective also, hand washing has been a very much part of the culture, isn't it so? I mean, wherever you remember and recall your grandparents, they always used to insist, before you have your meals, you must wash your hands. And this, now again, we are talking about hand washing, which is very, very important, because hands are the main pathway of germ transmission. So it's very important. I will not talk about anything. Let me concentrate on this, and I will be sharing more innovative practices, some of the practices which we have adopted in our school. Also, really, NGO contributed a lot by organizing so many competitions and so many other things. In India, also, health really has been an important part. 2015, when Swachhata Mission has been started by our Honorable Prime Minister, that awareness is very, very important. The dismal side is also there. We know that there are parts, not only in different parts of the world, so there is not a single drop of water. That we're talking about washing our hands, and there is no water, what we can talk about. Let's take government schools also. I mean, I know, I'll just share with you a story when one of my students, she shared about that, something about her friend that who's studying in one particular school in NGO, and then she started coming to school. What was the reason was there was no water in take bath and wash their face. So we are talking about washing hands. Of course, it is a long story, and the initiatives have already been started. That is a very good thing. Our country, which is there, and the facts also there, which I have, that as per WHO and UNICEF joint monetary program, that 40% of school in India, we do not have even facility. 142 million people without hand washing facility. So the fact is that, but the programs as in their pipeline are there, and also in the implementation is there. That is what we have to look. We need to be positive. We cannot talk that do not what's going on. Let's go on that. And I'm sure when all stakeholders are involved, be it parents and every part of the society, when it is involved in this mission, then certainly the results are going to be very, very gratifying. Because we know the programs are there, the planning is there, the implementation is there, the interventions are there. But what important point which we have practiced in our school, and I would like to share with you, that is empowering. Empowering right from support staff.
Sorry to interrupt, ma'am. Your voice is breaking.
All right, all right. Am I audible now, please?
Yes, ma'am.
Yes, ma'am.
Now I'm audible? Yes.
Yes.
So just coming back to the point that how can things be done, and what we have done at our school level, let me share with you some good practices which I really feel very, very proud of. And some of the practices are there that the children of our school, the student councils members are there right from class 5, grade 5 to grade 12. They conducted programs for drivers, for ayahs, for personal hygiene, and for washing hands. And they also, I mean, I could see the kind of the honor and the respect they were feeling, the ayahs, when the sessions was conducted for them. And they really expressed that they are so thankful to these young angels. Those they have tried to apprise them. They were thinking that it is of not much. Okay, every day coming, even they are not taking, but even if they are not washing hands, it is not so important. So this is one thing which we have done, empowered our children. They further conducted sessions for their fellow students also. And another important part is this: these are the students. They also invited, they also visited NGOs like Pahel, Vivek, and they conducted sessions for such students. They invited them also. So it was a very exchange of ideas where they could learn from each other. They could also understand what are the problems are being faced by the other fellow students also, even they're not so privileged. So that is a very important activity which I really like. Further, I would like to share with you that is a very important thing which we have done. Right in the beginning of the session, we decide that this is our mission which we are going to do, that is our SMART goal. So we had our SMART goal for last 2 years, zero litter and personal health and hygiene. And all scholastic and co-scholastic activities, that means all cultural activities, all academic activities, we focused on the theme of health and hygiene, and which helped children to reiterate, visit, and stay focused. That is what it was, again and again reminder for us, for them. For example, if I talk about academics, then when they are writing about stories, short stories, poster writing, so many things, it was integrated with academic. So as in co-curricular activities, whether it was debate, whether it was poster, slogan writing, street plays, skit, and right from the beginning, like assembly is the such an important feature of the school. If you start the awareness program from there only, I think everything is possible. And one can see the energy, the enthusiasm, and the passion, the way these children do when you give them, assign them some responsibility. Even these children, they performed plays at metro stations, lanes and bylanes of Dwarika, where my school is there. So it was really heartening to see their efforts. Even some of the shopkeepers, they wrote a note to us that really children made them and sensitized them so well, and they're very thankful to such children. So these kind of programs, when you integrate with the very curricular activities, with co-curricular activities, with academics, it is, everything is possible. Children can do really very, very well. As I've already mentioned with you, CSI activities, social initiatives. Last important thing which I would like to mention, that as a part of research and innovation department of our school, we also try to teach children how to save water and how to treat water, grey water treatment, because we are ourselves are doing this practice in the school. And there are many children, those they do not have this facility to have fresh running water. Then how the Shalan Kund, which was prepared, I would like to mention my biology teacher, Miss Nathani, and she really did the work on this project where she prepared a Shalan Kund wastewater and how to treat that wastewater for using hands and other activities. So if you have such kind of practices, and if you promote, if you handhold, if you encourage children, then everything is possible. At least small steps will play a major role to accomplish our goal, whatever we want. Finally, the last thing which I will tell about parents' contribution. Parents, though they were doctors, there are many parents who are doctors. So during pandemic, we requested them to conduct sessions for students, for teachers, for awareness, for basic hygiene, for social distancing, for using masks, and why it's so important to wash the hands so frequently, even cleaning the knobs and everything. And they conducted so many sessions. So you can also, very well seek their help also. And if all the stakeholders, I would also like to mention about school management, who have provided us such a good infrastructure where touch-free taps are there. And we have written everywhere the reminders not to waste water, washing activity and other things. So if everybody coexists together and contributes so well, so such synergy certainly can do wonders. So thank you so much having given me time. Stay safe, stay healthy, and sabka saath, sabka vikas, or sabka swasth is possible when everybody is contributing. Thank you so much.
Very true, ma'am. Thank you so much, ma'am, for this. We are so pleased to hear you. So over the years, Sharp has strengthened WASH practices across the country through scientific and systematically implemented behavior change. We have done this through our novel innovation and intervention. Here's a small video elucidating this. Meanwhile, I would also urge the audience to drop their questions in Q&A box. Ritik, would you please help us play the video? Thank you. We have more than 1,000 audience in this webinar. I hope we reach all the nook and corner of the country, and we are successful in creating the awareness in every corner of the country. Over to you, Sharon.
We have around 1,000 attendees, and while everyone was speaking, we had a lot of questions pouring in. So one of the questions from the audience is for Dr. Vijay, and it is, how can food hygiene be ensured in hostels and paying guest accommodation for students?
Yeah, this is very pertinent question, ma'am. Actually, we are having a different initiative where the different campuses are also being registered as Eat Right campuses. So if you have some institute or some mess or some place where people are sitting together and eating together, that campus can also be marked and registered as a Eat Right campus. How do we do that one? The people have to approach, and this is the free of cost system, where we will see what is there now. The basic means their condition, their campus condition, their kitchen condition, how they are maintaining this one, how they are keeping the coverage, where is the water source, and also where is the dustbin. Then we will train this health worker, those who are cooking the food there, or whether they are wearing this personal protective equipment while preparing or not. So we will see the different things. So there is an auditing agency, which is called as third-party agency. They will go, they will see the level. Okay, this is your level now. To reach from there to there, you need to be trained. So we will give the training to them. And after training program, then we will certify that campus, that canteen, that mess as Eat Right Campus, and same as I was discussing is also being done for the school. So there is a school there is scheme called as Eat Right Campus. Under that, somebody who have asked this one, please contact. I just want to congratulate the SARP NGO that I see that there are constantly more than 900 participants. Now they are approaching nearly 1,000. So it's a very, very good platform to change the behavior of the people and to tell the different scheme, because many of the scheme which are there that we make, we never reach to the intended people. So for the answer, this is that go and register for Eat Right Campus. We will teach them, and we will also give a certificate and certify that institution as a Eat Right Campus. I hope I am clear. If still not, you are always free to ask again.
Thank you so much, sir, for sharing about the initiative of Eat Right Campus. And so one of my next question is for Dr. Aparajita, and this is also from the audience. And it is that how has the Ministry of Jal Shakti strengthened wash practices in the country, as you spoke about the rural area, so especially in rural areas?
Surely. So in rural areas, typically hand washing has been an integral component of all our So wherever as part of phase 1 Swachh Bharat mission, we have been speaking about construction and use of toilet. At the same time, we have been talking about hand washing also at all critical times. Additional point of time, we have also been running various campaigns targeted at hand washing, because UNICEF happens to be a partner of ours. So these campaigns are originating also from children, and children are also our torch bearers about the campaign. So that is the other thing which is happening. The third thing which is happening is, as some of you might be aware, on 2nd October, a campaign has been launched for 100 days campaign, through which the target is to ensure sanitation and water facilities in all Anganwadi centers, all schools, including primary schools across the country. So these are various initiatives which are happening.
Thank you. Thank you, ma'am. Ma'am, thank you so much, ma'am, for sharing all the initiative by the Jal Shakti Ministry. So my next question is for Ravi sir, and as you have talked about many soap related and hand washing related initiatives, so one of the audience, her name is Sushila, she is asking, the area where scarcity is there, water scarcity, what can be the alternatives for washing hands?
Very interesting question again. So one is like, using the sanitizers that can be used. And secondly, there is a provisioning which is also earmarked by the Ministry of Jal Shakti. You will be hearing announcement soon from the ministry, and there are pipeline water getting laid in most of the villages in India. Like there was a very mega program of electrifying the villages. In the same way, the water reaching to the last mile. So one of the friends from ministry is also there. She may put more light on that. But India will get rid of this problem of when there is no water and all that. But definitely, water is a very, very scarce resource. And with the climate change and other things, we need to be very mindful of how we use it. And therefore, if one has the provision of using the sanitizers can be one of the solutions. I must put on record my appreciation for the Government of India, where Government of India during this pandemic also put a price control on the sanitizers prices. So the average price of the sanitizer was 80 rupees plus, and government very judiciously decided on putting the price for 25 rupees maximum for all the companies across the board, so that everyone can use it. And it should not be treated as a luxury product. It should be treated as something which is life-saving. Thank you.
Sorry,
Thank you so
my
much.
mic was mute. Thank you so much for answering, sir. So Aprajita ma'am, do you want to add something to it?
Yeah, so just to add very quickly, yesterday we had one of the talks from our minister was speaking, and interestingly, he was speaking to children only. So, a very important thing which has come up is it is sort of unfortunate that India is a country which was not traditionally water deficient. We have really lot of all weather rivers in this country. So I think, as my previous panelist also pointed out, that it is also important that while we are getting water as a commodity, or we are putting that as a right, wherein government is providing and everybody is working towards ensuring that water is available. At the same time, it is important that we are very aware and cognizant of our responsibility. Water is a scarce resource, and is, I mean, eventually becoming a very scarce resource.
Right,
So
ma'am.
what is it that we are doing towards its reuse, recycling, preservation? Efforts are on, and as part of various government programs also it is happening, as to how, one, we are not using water, I mean, since water is available, we are not using it indiscriminately, and at the same time, how are we putting water to reuse, recycling? So I guess all of us are working together, and hopefully we'll see better results very soon.
Yeah, sure, ma'am. We will try to reuse and recycle the water resources which we have. So my next question is for Dr. Manisha, as you talked about a lot about the stakeholders. So one of the audience wants to know that what precautions a teacher can take for food and hygiene safety in school during COVID situation. Not in school also, or in during like to give awareness to their children through online classes.
Yes, yes. So I will also talk about during pandemic also children should eat healthy food that the teacher can talk about, because all the time children, I mean, there is more of screen time, isn't it? So it's very important for children also to have the food which should be devoid of fat, isn't it so? And at the same time, post pandemic, when we are thinking of reopening of the schools, when the children are likely to come of class 12, it is very important that there should not be any sharing, because we need to maintain social distancing, which is very, very much required. So this kind of conditioning is very, very important for children, and as well as teachers are trying their best in between the session, during their teaching time also, they are trying to talk about, discuss about it. And we had it even the pandemic, this COVID conclave also, where children brainstorm themselves. They spoke about what are the things, how do they feel lighter when they eat certain kind of food, what is required for them when all the time they're seated during online classes, when there is a less of physical activity, and even when they will come to school, what are the things need to be taken care for. So these are the things, some of the issues which we have already discussed. And I think these are the things should be discussed with children as and when we get time to sensitize them. And we can also have orientation program for their parents too, so that I always talk about each and everybody's contribution. If we work together, handhold each one, the things can be better done in a more efficacy. Thank you so much.
Thank you so
I
much for
hope I
answering.
made
Yeah, yeah. Thank you so much for answering the question. So over to you, Aliza. The panel is all yours.
Okay, thank you, Sharon. Very quick questions from the audience I will take. Um, sir, Vijay Pal, sir, one question for you. Many hand washing stations and soap stations have been installed in schools. How can we work for the sustainability of these structures? This is asked by Rahul Ahuja.
Okay. Yeah, this is more a question related to the economic sustainability when it comes to how you can yourself sustain these things. So I'm not very sure because I'm related to food. Basically, I think Dr. Manisha is more empowered to answer this question.
Yes, certainly. I would like to share my views, because it is solely and wholly depends on the management. But we should take care of the stock, and soap dispensers should be taken care. Again, we can make a team and also empower of us support staff. Then whenever any what is required every month, there can be checklist also related to all dispensers, even the taps, the cleanliness, how the knobs and every area should be cleaned. There's instructions near tap and everywhere to save every single drop of water. So these instructions, checklist, and then taking care of stock every month can really can be done easily. That will not be a problem.
Okay. Parajita ma'am, would you like to add something?
Thank you. No, I think Dr. Manisha was fine. The only challenge that happens ma'am, in rural areas
Yes,
is
I do understand.
in urban schools typically. Yeah, so in urban schools, typically fund, etc., does not become a problem, but in rural areas, funds are really limited. So in there, what we do is one, of course, as some soap banks somebody was speaking about. So some initiatives of those kind are what we are encouraging people to, and also in terms of mobilizing their own resources. Plus, this time, special provision has been made under 15th Finance Commission, wherein sanitation and water, their 50% of funds have been tied for these activities. So we are in discussion with all sarpanches, all panchayati raj institution members, and asking them to make use of these provisions and ensure that all the initiatives which are made in a campaign mode remain sustainable. Thank
Okay.
you.
Thank you so much, ma'am. Another question for you, sir, Vijaypal sir. Why is food safety important? Foodborne illness are a preventable and underreported public health problem. These illnesses are a burden on public health and contribute significantly to the cost of healthcare. Although anyone can get a foodborne illness, some people get a greater risk. Is it correct?
Yeah, this is very good question. In fact,
So your voice
that
is breaking.
why food safety is important. So if you are eating unhealthy, internet is unstable. It says. So can you hear a little bit better now? I'm trying to put it. Can you, okay, let
Yes,
me put
yes, better
stop
now,
this
better
video.
now,
Can you
sir.
hear me now
Yes,
clear?
yes, yes, yes.
Okay, so this is really interesting question that why should we care about food safety? Food safety is very important as it may cause more, means a lot of disease. It can cause disease which are very acute like diarrhea, etc. But it can also cause the disease which are long term like tuberculosis, and it can also lead to the so many other lifestyle disease. Suppose if you are eating a lot of pizza, burger, and all these food which are high fat, sucrose, salt, and this one, you get obese, you get diabetes. So nowadays childhood obesity is also a lot of increasing, and that's why we are encouraging children to eat safe food rather than eating the junk food, the food which is like pizza, fried chicken, frozen kebab, burger, alcohol, noodles, sweetened beverages, bread and cakes, frozen snacks, and these things which are common into the canteen of the school are not very good food. Food which is local and seasonal and home cooked food is the food which is really good for you. So you may get disease which is immediate, you may get disease which is long term, but there are a lot of diseases which are foodborne, and foodborne illness is a greater health risk economically as well as physically to you. Economic burden of the food health is also, I don't know the data, but it is very, very risky. 7 factor out of the 10, 7 out of the 10 are related to the food. So the 10 risk factor, 10 most risk factor for the health, out of that one, 7 are related to food. So it is very important. And also it is very important to wash the hand, wash hand at least for 20 seconds. If you go, just do it, and thereafter take your hand out of it, it is not effective. And if you have washed your hand, but suddenly thereafter you have combed your hair and you clean your nose, that's also not very effective. Important is that when you wash your hand, you maintain the hygiene of that hand, and also eat healthy. Something which is put into advertisement is not always healthy. Important is eat seasonal, eat local, eat lot of water, eat something which is homegrown. Thank you very much.
Thank you so much, ma'am. Sir, a very quick question for Aparajita, ma'am. Working in a city like Mumbai, I am catering to urban slum students. Kindly throw some light over the same and need guidance to have such campaigns. Asked by Kasturi.
Okay, so Kasturi, in terms of guidance, of course, we have a lot of guidelines. We have a lot of material which is available on our website, as well as on our social media channels also. On Facebook, we keep on sharing a lot of stuff. On our YouTube channel, within Ministry of Jal Shakti, you can look for Swachh Bharat Mission Gramin. We have a lot of short videos. We have anthems. Swachhata anthem is there. We have some animation videos also for children. So those could be useful for you if you plan to design a campaign. But one learning which has been there from the program, which I'll want to share with you, is while you are trying to target children, while you are trying to target community for any community level intervention, or to bring about any behavior change, it is very, very important to involve them in it. Because typically what has been happening in most of the government programs, at least before Swachh Bharat Mission, I'd like to tell, is it has been very sort of supply driven. We think this is right, and then we go, we look at the community, we tell them this is your problem, and then we implement some solution. What is important is, don't make them beneficiary, rather make them a partner to what needs to be done. The advantage to this is the ownership is higher. And of course, many times the solution that we come up with are very from our understanding, very much from our understanding. It happens that many times community might be having solution among themselves. So if as part of the campaign design, step one could be going to the community, having a very informed discussion with them, making them aware of the problem, and then if solution and champions emerge from them, trust me, your runtime will be very short in terms of campaign, and effectiveness will be like centuries longer. Thank you.
Okay, my last question would be for Mr. Ravi, sir. How has the Ministry of Jal Shakti strengthened wash practices in the country?
Indeed, a very interesting question, Aliza. Ministry of Jal Shakti, Ministry of Swachh Bharat. So, on the maiden call by the Prime Minister, that was the first time any Prime Minister actually, from the Red Fort talked about Swachh Bharat. Although there were other campaigns before this, which were like, total sanitation campaign and other things. So government put a lot of efforts towards bringing the public-private partnerships. Especially if you see the SDGs, there are 17 SDGs for those who don't know it on the, from the audience side, if some of them. So it is the Sustainable Development Goals. So the biggest goal is the goal number 17, which is partnerships. So through strong partnerships, you can achieve the other goals like goal number 3, goal number 6 on water, on sanitation, on climate change, and climate action, and many other things. Government put a sense of, competition among the cities. So government started with the Swachh Sarvekshan. And every year, all of us know, like, Indore is topping from last 2-3 years. Varanasi has made a place in the top 10. And, Surat has also improved tremendously. And everyone is under the competition. So, and there are indicators ranging from, building of toilet to usage of toilets and the independent studies, etc., etc. So it's so a lot of credit goes to making sure the toilets reach to the last mile. And this all is also vetted by the external agencies, like UN has also vetted. Gates Foundation also conducted a study and told this was one of the very, very fabulous programs in terms of the social behavior change nudges. And a lot of learnings were also taken from the neighboring countries, like you have Bangladesh, where a community-led total sanitation (CLTS) methods and methodologies were used. This is my last sentence I will be contributing for today. I must personally thank Mr. Paramaiyer, who has gone to his home career in US and the World Bank again. His leadership, along with the Prime Minister Modi's guidance, was tremendous to make this program a not government program, but a true Jan Bhagidari, where schools, professionals, teachers, kids, everyone participated. And there were other people also like Akshay Raut sir, he's retired. Now you have the Yugal Joshi there, amazing guy again. Along with that, UN is also playing certain role, but as Prime Minister Modi says, UN needs to move fast based on the, country scenarios. So we are with the government, and I'm very proud to say, like Government of India started Swachh Bharat Mission. We were one of those who signed our early commitments on the Swachh Bharat in less than 24 hours. And we have taken this program to the countries like Nigeria. We have the Clean Nigeria program. We have Poricho Bangladesh, which is same like Swachh Bharat Mission in India. We have done Saaf Saaf Hoga Pakistan. Although the terminology is very funny, so a lot of people laugh on that. But definitely, we have taken this program to 4 other countries, and we have larger plans to take it to the other places also. With this, I will be signing off for now. Thank you very much. And Aparajita ji, it is an honor to meet you over here by virtue of being with Sharp. And sometimes we should also catch up. Thank you, guys. Thank you so much. Cheers.
Very well answered, sir. Thank you so much.
Thank you.
Okay, so with such a huge audience and active participation, we have introduced a spin wheel, a wheel of fortune, and we will be taking questions from the audience directly. Because of the time restrictions, we are not be able to take all the questions from the audience, but you can always write to us. So here we go. Okay, so Sushila Sikka from Faridabad, role of teachers to guide students for online safety measures. Hello, am I audible? Hello?
Yes, Aliza, you are audible. Please continue.
All right. Manisha ma'am, would you like to answer this?
Yes. Online safety is a lot of things are there. Online safety also takes a lot of issues about cyber safety also, which is not pertaining only to physical health, but there are so many things are there about safety measures, because children should be aware of, because this is not the topic. I'm just talking because what the question is about online safety measures, isn't it? So online safety measures can be with reference to your cyber security, cyber laws. The children should be made aware of that, so that they should not visit such sites. They should also be made aware that whatever sites they are going, whatever they are doing, their digital footprints are always there. And then restricting time, also screen time, taking care of their eye health. All these things are very, very important things, starting from cyber laws, cyber awareness, sensitizing them, or also taking about if too much, if in between the classes it has been observed that they start playing, they have their so many online gaming starts also along with their friends. Even the parents are so vigilant, but then also they do play and they're distracted. So what happens as a result of that? Their mind, they're tired, they're aggressive, a streak of violence is there, they're sitting all the time. So just, it is very important teacher do sensitize them about what are the things it lead to their mental health issues. So these are the things teacher must focus on, that whatever they do continuously, if they are just playing, even if they are busy all the time on classes for whatever the reasons, maybe more than 3 hours, 2 hours, then what are the repercussions? They should be aware of that. It affects their mental health. It is very, very important issue. They will not be able to think, and it will affect their eyes too. So these are some of the issues which should be taken by the teacher. She can also seek help of any doctor, parent, or anybody else who can come and conduct session for students. So that should be very effective for them. Thank you so much.
Thank you so much. Can we spin again? Okay, so the next question is by Rizwan Sayed from Pune. Insights on demand and supply for hygiene goods. The growth rate for this segment, market value, consumer, are business sentiments. Dr. Vijay, would you like to answer this?
This is Aliza more business oriented, not related to food.
Right.
I think let's spin this
Anybody
again.
who volunteers from the panel to answer this question? Okay, Aarti Kakkar from Faridabad, how to make toddlers aware of hygiene and of self and surroundings. I leave up to the panelists, whoever wishes to go for this question.
I think school toddlers, I'll just mention, and others esteemed panelists can add to that. Of course, the teachers can narrate so many. I mean, I'll share with you the story narration is such a powerful tool. With stories, if you can sensitize children, with even online showing them some puppets, some masks, and build up the story, they will, and build such characters. You engage them, they will understand. That is one way. Others can lend their, they can share their
Aparajita
views
ma'am,
on.
would you like to add something?
In any way, if any student, any human being who's actively engaged in any activity, then he or she can learn very well, even if he or she is a toddler or a very small child. That is what I strongly believe.
Okay.
I
Thank you so
mean,
much.
Manisha ji is, of course, a greater
I am there. And in
scholar
addition,
on children and their behavior.
presentations also
But
can
I
be shown.
think toddlers, for them becoming self-aware itself is an important activity. So I think as part of that activity, they pick up. And what I have also felt is a lot of their activities mirror the action of elders. So rather than really instructing them, they mirror our actions. So maybe through that, probably we can impart all good behaviors, especially hygiene related behaviors to our children.
True, they imitate a lot. That is right. Absolutely.
Yeah.
Thank you so much, ma'am. It was a wonderful session having you all here on the panel, with such esteemed panelists. We are so glad that you all joined and made it such a success. Thank you so much. Over to you, Sharon.
Thank you so much, all the panelists and the audience who joined us today. And I just want to conclude that we had such a great discussion on healthy eating, food diversity, hand hygiene. Thank you, Manisha ma'am, Aprajita ma'am, Vijay sir, and Ravi sir. And thank you, Aliza, for co-hosting with me. And so there is now a small feedback form on the screen. Kindly fill the feedback form. So also for further updates of our work and webinars, I would request everybody to subscribe the website, and your certificates will be mailed to you soon. And we hope to see you all for our next webinar on next Saturday. And the topic will be announced soon in all our social media handles. Thank you so much, everyone, for joining in today and taking out time for the webinar. I once again thanks all the panelists for joining us today. Thank you, ma'am, and thank you,
Thank
sir.
you so much. It was an honor having you all here. Thank you.
Thank you so much.